Baby Safety Month comes to an end, we're joined this morning by Dr. Kuehnel, a pediatric emergency physician with UW Health Kids in Madison. Good morning, and thank you so much for joining us this morning.
Yeah, thank you for having me for this important topic.
Right. Each year, we lose about 3,500 infants to sleep-related deaths. Why is that, and what can be done to prevent this from happening?
Yeah, it's unfortunate. Most of these situations are due to accidental suffocation from co-sleeping when it comes to sleep-related deaths. And there really is deserves special attention because there's clear guidance around how to prevent this from happening. It's just why it's extra important anytime that you're putting a child down for nap or bedtime to make sure to lie them on their back on a flat, firm mattress with a tight-fitting sheet, making sure there are no blankets or stuffed animals around them, and making sure they're in the appropriate sleep apparel or sleep sacks to help keep them safe. I also always recommend have them, especially with infants, sleep in the room with you and not in the bed with you. Having that bassinet or crib at the bedside allows for you to tend to their needs quickly at nighttime as needed, but doesn't put them at that accidental risk for suffocation from co-sleeping.
All great safety tips for parents. What are some other types of sleep-related injuries that are common among babies and young children?
Well, outside of that, those are the most common sleep-related injuries that we see. Other injuries that we see in the household occur that can be pretty severe and even lead to death as well, include falls, include burns from hot water being pulled off the counter. Furniture could potentially tip over and injure the child, and also motor vehicle accidents in younger children as well.
Definitely lots of things to watch out for. What is some other safety advice that you would give, especially for new parents for their newborns or young kids?
Yeah, there are a couple of things to keep in mind, and one thing that seems a little bit silly, but I always find helpful is getting down on your hands and knees and literally seeing the world from their point of view. Once you do that, you'll quickly learn things and identify that need extra safety precautions, such as caps or covers for your outlets, seeing what cabinets or drawers are at certain heights that need locks to not be pulled open, what furniture, as I mentioned earlier, could potentially tip over if pulled upon. Are there any cords hanging from the windows that the child could get twisted in? Or are there any other objects just on the floor at that level that really should be put at higher levels away from their reach?
Definitely all important things to keep in mind. Dr. Kuehnel, thank you again so much for joining us this morning.
Of course, thanks for having me.